Good afternoon. Thank you for tuning in and, of course, staying with us right here on Women Radio WFM 91.7. Today is Friday, so thank God it's Friday. I hope that your week has been great and, well, you're planning to have a great weekend. Well, thank you so much for joining us today. You're welcome to The Big Question right here on Women Radio WFM 91.7. My name is Rose Yusuf Kaiser. The Big Question is a program where we discuss and propose solutions to issues affecting us as a nation and as citizens. The Big Question comes to you Mondays, Wednesdays, and Fridays at 12:05 p.m. So you can always log on to our website www.wfm917.com to listen live from any part of the world. And of course, our social media platforms are there: Facebook, Instagram, X, and of course, YouTube at WFM 917. So these are different platforms that you can get in touch with us for the big question and any of our programs that will be coming up. All right, so today on the big question, we'll be discussing pregnant women in urban Nigeria, skipping hospital antenatal. We know how important this is for pregnant women, but today we're talking about pregnant women in urban Nigeria, skipping hospital antenatal. Now, the ratio of maternal mortality has remained high in Nigeria as it contributes 28.5% of the global maternal mortality ratio, being the second highest maternal stillbirth and neonatal death in the world, followed by India. Unfortunately, the Nigerian health sector, with its many challenges such as long queues in hospitals, limited access to doctors and right information, and of course, wrong diagnosis, has made some pregnant women in urban areas to skip antenatal in hospitals and depend on telemedicine for the care they need during and after pregnancy. So today we're examining pregnant women in urban Nigeria skipping antenatal, hospital antenatal to depend on telemedicine, such as Preggify. Now, a solution journalism reports by Esther Alaribe, produced by Women Radio 91.7 in partnership with Nigerian Health Watch through this solutions journalism network, looks at pregnant women in urban Nigeria skipping hospital antenatal. So let's go ahead and hear this report by Esther Alaribe on this particular topic. And after that, we'll come back and discuss further. Stay with us.
Despite effort targeted at addressing maternal death across national and subnational levels, the maternal mortality ratio has remained high in Nigeria as it contributes 28.5% of the global maternal mortality ratio, being the second highest maternal, stillbirth and neonatal death in the world, followed by India. A 2023 UN report on trends in maternal mortality from 2000 to 2020 reveals that a woman in Nigeria has 1 in 19 lifetime risk of dying during pregnancy, childbirth or postpartum, whereas in the most developed countries, the lifetime risk is 1 in 4,900. This is the sad situation Nigerian women are in. The World Health Organization's recommendation for a functioning healthcare system is 1 doctor for every 600 people. In Nigeria, however, the ratio is 1 for every 4,000 to 5,000 patients. The Nigerian healthcare sector has had major challenges, especially with primary healthcare, which is the closest to primary healthcare, unfortunately, receives the least attention, leading to preventable deaths, especially for pregnant women who cannot afford better healthcare treatment from other sources. These women resort to self-help and unprofessional alternatives to guide them through pregnancy and childbirth. The traditional model of hospital-based pregnancy care poses significant challenges for expectant mothers. In a survey carried out by Women Radio, 90% of women noted that these challenges include long wait times for appointment, limited accessibility to healthcare facilities, and fragmented communication between patients and healthcare providers based on personal bias or offshoot of workload stress on medical practitioners. The introduction of telemedicine in Nigeria's healthcare system began in early 2000s with initial projects focusing on tele-education and teleconsultation. Telemedicine gained significant momentum in 2010 with private sector investment and government support. Today, this approach to medicine is becoming increasingly popular in Nigeria, with various platforms and services available aiming to improve healthcare access and quality, especially in rural and underserved areas. 30-year-old Sandra Ozulonye is a first-time mother who lacked the experience needed to carry a child. She lamented the lack of access to necessary information in public hospitals. According to her, she couldn't access doctors as frequently as she needed their services. She said that public hospitals lack new information that is vital for the mother and unborn child or children and are not up to date.
One of the motivational reasons why I joined was because on the general platform, I saw how the doctors were so ready to answer our questions and how the platform was, how will I say, supportive actually, for because I am a first time mom, so most of these things, the experiences, the whole process in the whole symptoms and other things that comes with pregnancy, I didn't really understand what was happening to me. So on that platform I saw how it was like explained to us and everything. The hospital I was attending antenatal, there was no much thing. I was not learning much. I would just go there. There was nothing new to learn and all those things. So that was the motivational reason. That was why I joined Preggify. And Preggify has been helpful to me because, as I say, I was a first-time mom when I joined. And on the platform, it answers all our basic questions. The doctors are there, very responsive, and they take us on different classes. We don't even need to say the topic. Some people will suggest some things maybe they don't understand, and the doctors will take it as a topic and teach us and all those things.
Mercy Emmanuel had lost two babies to premature birth, alleging a lack of enough medical attention. In her interview with Women Radio 90, have cost her life. She described the experience as devastating and that it looks like doctors in public hospitals don't really care about their patients.
Immediately I found out that I was pregnant, I registered with Preggify because prior to this particular pregnancy, I lost two children due to prematurity. So when I took in for this one, I registered with Preggify immediately. Even though I also registered physical antenatal with the hospital close by here, I was following Dr. Fonanya online. So because for my own case, because I've had preterm birth, which two twice, she advised me to look for a gynecologist to follow it up, to follow the pregnancy up and see why I had that preterm birth, so that this particular pregnancy will not end up like the other one. So I got a gynecologist around me here in Abuja, and he just started the examination. He did physical examination and told me that I will be needing a sacrilege, that before the sacrilege, which is above 200,000, that is going to be giving me injection. The injection will be costing me 200, 150. I don't really know the name of the injection. So my husband and I was like, is it not too expensive? He said the injection is foreign. So I asked the gynecologist, am I supposed to run some tests or kind of tests? He said no. He has examined me. He have seen the cervix is short. That you don't need any test again. I said okay.
Founded in 2022 out of passion for women, Preggify is solving some of the problems faced by Nigerian women. Speaking with Women Radio 91.7, the founder of Preggify, Dr. Ifunanya Igwezi, said that the motivation behind the establishment of Preggify was her personal and professional experience as a doctor.
The primary problem of these pregnant women is not getting personalized care, having to spend long hours in the hospital in order to even get their questions answered, and not getting to spend enough time with the doctor, thereby leaving the hospital confused, and not being able to get to talk to a doctor, to sort out their day-to-day challenges. So for these women, especially the working class women, we provide them a 24-hour pregnancy support where they can call in or chat with any doctor, whether it's in the morning, afternoon, or night. So it's a 24-hour pregnancy support. This helps them to sort out most of their challenges at home and get a direct home remedy, over-the-counter prescription, or prescription medicine delivered to them anywhere they are. We also organize educational classes for them weekly to help them stay in the know for about information, basic information they need to know, because most of them are working class women. They barely have time to spend in the hospital listening to these teachings, and most hospitals don't do teachings again on the other hand. So at Preggify, they were able to connect with these teachings from anywhere they are, whether you are in Nigeria, on vacation outside Nigeria, or you are living other places around the world.
At Preggify, pregnant women are able to connect from anywhere they are in the world.
Since inception in 2022, we provide at-home testing support. So both the tests they can do by themselves as women, like their urinalysis, blood pressure, blood sugar. They can do those on vital signs. We guide them on how to do it, and as soon as they're done, they report to their doctor for analysis and counseling. And then the ones that require major testing, but they're not able to go to the hospital or laboratory. The laboratory can be sent to their houses to take their samples and get the test done and then reported back to Preggify for follow-up.
For Sandra, what she finds most fascinating is the attention given to expecting mothers' mental health.
We enjoy mental health support, and also we get mental health screening at least once a month to rate our mental health status and to be sure that none of us go through prenatal depression. And if the test is taken and anybody scores high score, has a high score rather, they send a three-way support system where they can advise us on what to do. And they also tell our partners, and then Preggify will follow up on us to make sure that we are fine. And still, they'll keep checking upon us to see that we are doing okay through the journey.
According to Dr. Ifunanya Igwezi, Preggify now has a community of 2,000 women and 250 premium users within Nigeria, Ghana, the UK, US, Canada, and other places. At the moment, the service targets women living in urban areas because the primary client are working class women or business women who have access to their smartphones and the internet.
I am a first time mom that has little or no knowledge about pregnancy and pregnancy care support. In my first trimester, it was difficult to get doctor's attention at the hospital. Getting to know Preggify, I am glad that Preggify made it easy for me to have access to medical care from the comfort of my home without having to run to the hospital at any slightest complaint.
Adesonoye Arayemi Precious disclosed. Adesonoye, who bemoaned the unavailability of 24/7 medical services to pregnant women, said that visiting a hospital most of the time even compounded her challenges because it was time wasting. She added that Preggify helped her access medical care without having to rush to the hospital at the slightest inconvenience.
I wish I could have enough information at my disposal so I don't have to physically be present at the hospital due to slight inconvenience. Getting enough health information and tips on how to be able to access quality health care will save pregnant women from unwarranted death.
Adesonoye noted that one of the perks of the platform is the opportunity for their partners to learn how to care for them.
Preggify gave me adequate information, medical information, and healthy tips from meal plans to healthy routines that I can do to make my pregnancy journey smooth and easy. Preggify also make it possible for my husband to know more about pregnancy journey and how smoothly it can be with adequate support from medical personnel and people around us.
A fertility physician, Dr. Collins Aboloje, said that the role of telemedical apps and digital platforms is to provide advice. He added that the Nigerian community is still far behind in the embrace of telemedicine.
So the world in recent times have experienced a huge jump in the practice of telemedicine and also in the number of digital platforms that have sprung up, to take up the task of delivering healthcare services to an extent, especially to the vulnerable population, which is even to women and children in recent times. So basically, this is good. This is the order of the day. It is increasing. It's on the increase, and a lot of people are embracing it. But there's still much that the government can do for people now, in this case, to be able to make life easy in such a way that they are able to actually afford internet services, because these are internet based services. So basically, if you do not have an internet enabled device or internet enabled what's the word now, platform. I mean, you won't be able to actually access things like this, even if you have all the money in the world. So the question now is, will the rural communities or people in the interior rural communities be able to afford services like this? So this would only now, in this context, be limited to people who are affording. And these people mostly would not be people even in the rural communities. We're not talking about people in the urban communities and all. So Nigeria has one of the highest maternal mortality rates in the world at 512 per 100,000 live births. And this is quite far from the set target of the Sustainable Developmental Goal, which is to see maternal mortality rate of 70 per 100,000 live births. And basically, in this environment, the chief causes of maternal mortality actually include obstetric hemorrhages, hypertensive disease, which are the preeclampsia and eclampsia, septic abortion, and of course, obstructed labor. And it is said that around 1 in 42 African women die during childbirth. However, in Europe, only 1 in 2,900 women die during childbirth. You can see the wide disparity. So this immediately shows that there is still much to do, because allowing, now this is just to state that allowing maternal mortality rate to increase, okay, is a clear violation of the rights of women, which is the right to life. So efforts should be geared towards the reduction in the maternal mortality rate of this country or of any country. So basically, there's still a lot that has to be done. So this simply now means that collaborative effort is key in this setting, so as to allow the benefits, okay, to be fast spread, okay, not only limited to a particular group of people who are people that are affording, but also to the general populace.
Running Preggify has not been without challenges. Dr. Igwezi highlighted funding and lack of access to collaborations with stakeholders as a challenge faced by Preggify.
We face challenges just like other startups, health startups out there, and startups generally, where you have a product, you have a solution. This solution works, is impactful, like it's changing people's lives. But again, it needs funds to drive it to reach wider population, because no matter how beautiful a product or a solution is, no matter how good and impactful it is, if it fails to reach to move from reaching hundreds of women to thousands to millions, it will not work. Okay, it will only be heard of, oh, there used to be. But when you have the network, the network, like access to resources, both material and financial resources, access to networks like, oh, Ministry of Women Affairs, Ministry of Health, Primary Health Care Board, Maternal Health Service Commission, all those places where you have access to them and present this kind of solution to them, and they adopt it and now spread it to general hospitals, of primary health centers, and even spread it to private hospitals that deals on maternal health, that reports to the government. You see that it's going to reach everybody when the kind of government adoption comes. So there's also a problem of gaining access to such adoptions also. And yeah, of course, funding in form of grants or equity funding is also getting those things it doesn't come by easily. It doesn't come by easily, and funding is what you need to even get enough workforce to push the solution, to talk about the solution, even to market the solution and make it known. You still need funding.
Further addressing the challenges faced by the organization, Dr. Ifunanya Igwezi said that the unavailability of data and statistics is another challenge. She noted that Nigeria does not have robust data on maternal health.
Another challenge that I would say we're having is data, yes. Nigeria do not have robust data on maternal health. It's not uniform. There's no uniformity in the data, and the data is not so much like you see in UK or US. So sometimes when you're making references, you tend to reference Western countries instead of Nigeria or somewhere close to Africa. So if the government will fund more researches in our institution, so that we'll have robust research that people that want to build solution can rely on and do this. And even if the research are not published, it should be accessible to organizations that need them to provide practical and impactful solutions such as Preggify.
A sexual and reproductive health rights activist, Omolola Pedro, said that the nonchalant attitude of the government is why the country is still dealing with high maternal mortality in 2024.
While the work being done by Preggify is laudable, I mean, it's a very commendable one, we need to also remind ourselves that no technology or telemedicine can replace the government's responsibility to its people. It is bad enough that the Nigerian healthcare system is in a very terrible state, but it is even worse that women and children are not prioritized in this side of the world. The Nigerian healthcare system needs a complete overhaul, and we need to have more women oriented initiatives than ever before. Leveraging technology is to improve women's health is something that the Nigerian government needs to put more investment in.
The global outlook on telemedicine is rapidly evolving, and it has the potential to significantly impact maternal mortality rate, particularly in low resource settings. According to the World Health Organization, telemedicine can help reduce maternal mortality rate by 30 to 40% in developing countries and 10 to 20% in developed countries. Despite challenges, telemedicine has the potential to revolutionize maternal health care, improving outcomes and reducing mortality rates globally. As technology continues to evolve, it is essential to address the challenges and ensure equitable access to telemedicine services for all. This story by Esther Alaribe was produced by Women Radio 91.7 in partnership with Nigeria Health Watch through the Solutions Journalism Network.
Put on your church shoes, little sister, because we're about to blast off!
What is it you're trying to say?
It's time to buckle up, because we're in the driver's seat.
Women Radio 91.7. We are Nigeria's only radio station for women and their families.
Ahead and calling. Let's get to hear from you this afternoon. You've heard from Esther, and I'm sure that you might just have one or two questions in mind for Esther this afternoon. All right, Esther. So let's just go through this report together. As the reporter of this article, kindly take us through some of the findings you made as to why pregnant women in urban areas, in Nigeria will skip antenatal care, which we know is extremely important because you go to different hospitals and they tell you, do not miss antenatal, do not miss antenatal. But, in this part of the country, you find women in urban areas, not even the rural areas, who are skipping antenatal. So kindly take us through your findings.
All right, Rose, thank you very much. So, in the course of this report, having to look around, we're able to look at some hospitals, look at what women have to go through on antenatal days. And usually, the queues at the hospital on antenatal days, really, for a woman who has a full time job and has to still manage going back to work every day after the antenatal, it actually can be a whole lot because sometimes they end up spending longer hours at the hospital because you might go to the hospital with one complaint as a pregnant woman and you end up visiting the doctor and you're being asked to go do so many other tests. And of course, we know that where we are at in Nigeria when it comes to giving women grace in the workspace or in the corporate sector, we're not really there yet. As even as a woman, when you call in sick or on your period, you're on your period and you call in sick, somebody's looking at you like, so because you have your period, you're not coming to work. Yeah. So imagine having to always frequently take excuses to say, oh, I'm going to the hospital for antenatal every single time. Some people might perceive you as being unserious or not being committed to the job. So when having to dig deep into this one, looking at the queues of women having to wait every single time, Tuesdays, Wednesdays, depending on what hospital it is that the woman uses for her antenatal, people get to wait. So it means like the entire day is gone. Having to find solutions that get to bridge this gap, we need to recognize that this solution that Preggify is bringing, we need a lot more in this area to ensure that it is very, very functional, and there are also downsides to it as well. Preggify is doing something I find really amazing because it's helping women cut down the time that they get to spend at the hospital. Also, there is the one-to-one personal treatment there. One of the women who spoke to us spoke about the mental health aspect of it, and that's one thing that a lot of us Nigerians are not really taking, we're not really acknowledging or putting a lot of spotlight on it because just as the way every day-to-day person would have issues, sometimes mental breakdown, you experience fatigue, irritability, and all, the pregnant woman possibly would experience maybe twice the same that you would because she's still going about her normal life. Her health challenges are almost double now because she has to be careful of where she sits, how she sits, what to eat. Every single thing is heightened at this point. So having to go to the hospital and spend longer hours and you probably will get home and due to sitting or standing for very long hours, you end up with another complaint that will still make you come back to the hospital again. Preggify is bridging this gap, and also for the mental health support too, it makes a lot of sense. There's also the part that actually ensures that the partners, the men,
Yeah.
understand how to support the women in this times as well. That makes a lot of sense because in cases whereby women are being asked to come for antenatal or come with your husband, let's talk to your husband. We know how men can be like, and for men who are listening, please, you really need to do better. Men will tell you, oh, you have to be at work, and they'll give you all of the 1,000 excuses in the world why they cannot follow the women for the antenatal. And there's some things that they really need to get directly from the doctor because I'm not saying that the woman cannot give them the information, but there's something called first-hand information where you're hearing directly from the doctor. So when these men are able to go to the hospitals with their wives, but of course, even for the women, you get to spend almost the entire day or good amount of hours. Now you want them to also bring their husbands in for the antenatal. Of course, you mean that that's going to be like a lot of no, I can't make it. But looking at what telemedicine is doing and how the kind of solution that Preggify is providing, it allows for the man to be able to join the woman virtually as well to speak to the medical practitioner that she wants to speak to, and there speak to the medical practitioner, and the person is able to say, this is what you need to do for this woman, this is what you can do, she's supposed to take her medication at this time. So it is still within your comfort zone. You're not necessarily having to spend or map out an entire day to make this happen. So yes, there are challenges. Yes, there are challenges. Just like issue is one big issue. I mean, if you talk to any business right now, any business right now, they will tell you that they are facing a lot of challenges
right now, talk to any.
Yes.
And
Uh-huh.
when we see initiatives like this, it is best for us to find ways to support them, because it's not just about spotlighting these initiatives, it's about the solutions that they bring. But another interesting thing would be the words of the um, one of the ladies in the interview, this sexual health activist, Omalola Pedro, having to talk about the role of the government as well. This is where the government needs to come in, provide support, provide funding for initiatives like Preggify to ensure that women who are in urban Nigeria can buy into this, and it can get like more support for them. Now, this downside to it is, the question is, this particular initiative is definitely tied to women in the urban areas. Women in the rural areas um, still need a whole lot for them to be able to match up or to be able to fit into this bracket of women who can use solutions such as Preggify. Now, you'd ask what the reasons are. The reasons are clear. Electricity, in some areas, they still don't have electricity, or it's not constant or whatnot. And if you look at the data, the people who still don't have smartphones. So for somebody who doesn't have be able to get connected, to be able to use such initiatives. So it means that some people we still need a whole lot for the government to do, to make sure that some people are still able to come up. And one of the women who spoke in the interview as well spoke about how it feels like sometimes the doctors do not really connect to the patients one-on-one. And to be very honest, you go to the hospitals, the workload, even you as a patient, you can see that this doctor looks overwhelmed. You can see that this doctor has so many people to speak to. So there is almost no time for you to keep going at them and asking them questions back and forth, back and forth. You also want to feel some sort of, I see you, I see your plight as well. You don't want to ask them so much. You want to be able to just find your ways and just leave their office in good time. But you go away feeling like, oh, there's so much more I could have asked you. There's so much more I would have wanted to say if I had opportunity. So these are the issues that solutions like Preggify are still facing.
Okay. Thank you so much, Esther. I just feel like you just answered all of my questions at once, because I was also going to ask you some of the challenges that, a telemedicine such as Preggify gets into. So let me just delve into that. All right. So the phone lines are still open. You can dial the number 07000 Our toll-free line for our female callers is 08007. That's 0801235 917. Go ahead and, of course, send us a WhatsApp message to 070 317 56537. Let's get to hear from you. Let's get your thoughts, your concerns, and your thoughts on telemedicine, as it is bridging the gap, in terms of pregnant women getting access to the adequate care that they actually need during pregnancy. All right. Now, Esther, you mentioned a lot of things about Preggify, bridging the gap, and all of that. And now we've been able to, establish that yes, telemedicine has come because of technology. But at the end of the day, is it something that is sustainable for us? As because year in, year out, day in, day out, you always have pregnant women, and we have a lot of them. There are some who don't even know that we have things like telemedicine, or we have Preggify out there that can actually help bridge the gap. Now, with things like this and the amount of pregnant women that we have, do you think that this has actually come to stay? Because I mean, our Nigerian government is one thing. If we want to talk about it, our health sector and all of that. So, do you think that if we eventually get it right, in our Nigerian health system, do you think that telemedicine such as Preggify will, still be around, or is just because of the lapses we have in the Nigerian health sector that we have telemedicine such as Preggify existing?
Okay, so I think that we can look at it from different points of view. There's some people who, regardless of how easy breezy things get in the health sector, that would still go for solutions like Preggify. For Preggify, you can always reach out to a medical practitioner at any time of the day. So even if you still have to go into a physical hospital, at least you're speaking to a medical practitioner who can tell you what to do, sustain you up until when you're able to go in to visit the doctor. Now, with telemedicine, Now, let us all not forget that in as much as the tides are changing, we have remote workers now. People are not working fully. Even as a remote worker, even when you're working from your home, when you're working from home, you still have to clock in to let people know that, oh, yes, I'm working and I'm going to be available within the working hours uh, period. So, regardless of how easy breezy our health sector gets, there are people who will still always want to choose these initiatives because of there's audience preference. There is I can get what the hospital cannot give me on these platforms, and I'm still going to be there. And also, it is still very important that we have to see like the government support innovations, initiatives all year round. We're always going to be having pregnant women. We're always going to be having pregnant women. And where we are right now, we don't have the numbers of medical practitioners that we have to be able to go around all Nigerians to take care of Nigerians properly. So solutions like this will still be the in thing.
Hmm. Okay. All right. So that means telemedicine such as Preggify has definitely come to stay. So we hope that we're able to utilize this, and we're also able to carry the women in the rural areas along, because I mean, if we want to even face what they are, if we want to even talk about what they're going through, I think that should be a program for another day. All right, now so let's come back to your call to stakeholders in Nigerian health sector and telemedicine also, in providing adequate and timely care for um, pregnant women. All right, I think we have a call. Let's see who we have online. Hello, good afternoon.
Good afternoon, madam.
Hello, good afternoon.
Good afternoon, madam. Good afternoon, madam. My name is Janet from
All right, so I
Yanoba.
think we'll just let you go. Do what to call us back on 07000 917 Send us a WhatsApp message on 070 317 56537. Hello, good afternoon. All right, so do what to call us back. Let's get to hear from you this afternoon, because I mean this is something that concerns a lot. Always I mentioned earlier. So it's definitely good that they are aware of telemedicine such as Preggify, and of course we get to also know of such technologies. Hello, good afternoon.
Madam, good afternoon. My name is Janet. I dey call from Yanoba.
Yes, what's your name? Where are you calling from?
My name is Janet. I dey call from Yanoba.
All right, Janet from Yanoba, you're welcome. Go ahead, let's hear you.
Abeg, I like wetin una talk today. The thing dey interesting. Sorry, I no sabi speak English. Na pidgin I dey speak. I wan know this report wey this lady do. How I go fit tell my husband make he follow me dey go hospital, because as I dey so na 4 months pregnancy I carry for belle. My husband no dey like follow me go hospital. How I go fit convince him man? Na wetin I wan know.
Okay, all right. Thank you very much, Janet, for calling. You definitely your question a valid one, because Esther don't even talk and serve earlier. Say some men know they agree follow their women go hospital, but because of Preggify now, all this kind technology where we get now, some they agree sit down with their wives, make they see say they talk to doctor. But Esther, I will let you chook mouth on top waiting. Janet just talk now. How we feel encourage more men to the reach hospital like this?
Okay, so the thing is, for this kind of men who do not agree to follow their women to hospital, these women are at stake. And they have a whole lot to lose if anything should happen to that woman. I think that some men just look at it from the point of, oh, women have always been pregnant from time immemorial, so yours is not going to be different. But I think it needs to start from marriage counseling. They need to start telling them exactly what they need to know right from that stage. Start letting your husband know that you need to be able to know that is not where it starts and ends with. That is not where it starts and ends. A lot of men need to understand this, and they need to find ways to ensure that they make it compulsory for men to come in, even if it's just once a month. come in and be able to there's some checks or something. It's not when the woman starts falling sick or she's slumping because of exhaustion, then you now start running helter skelter. You can put certain measures in place. If you're always visiting the hospital with her, then you would know what to do.
Okay. All right. Thank you very much, Esther. So I hope that Janet, you have been able to at least get one or two things from what Esther has been able to say, because I mean, we will keep talking until we actually have them follow us to the hospitals. Okay, 07000 our toll-free line for women. It's 0800 1235917. Hello, good afternoon.
Afternoon.
Hi, good afternoon.
Hello.
What's your name? Where you calling from?
Am Hello.
Go ahead, please. Yes, I can hear you.
Oh,
What's your name? Where you calling from?
my name is Bola. I'm calling from Abu.
All right, Bola from Maburu. You're welcome. Please go ahead. Let's hear you.
All right. I just ask you comments to make
Okay, go ahead, please.
the most important things that I feel like the society is where we have limited access to healthcare, especially for women. And having this report come out, I think it's very impressive, and it's a good one, especially notifying women, both urban and rural, that it's very important for us to take care of. So that's for us to keep encouraging our young women out there, even the ones older, that women's health care is one of the most important things, and check. So I just want to commend the reporter and also keep advocating and ask the government to look into other aspects of suffering from fibroids, PCOS, a lot of health issues. And we have. Thank you very much.
All right. Thank you so much, Bola, for calling and commending Esther for the report. Thank you so much. We do appreciate your call. All right, so let's see if we can just squeeze in one more call. But before that, Esther was asking about your call to stakeholders in our Nigerian health sector and, even in the telemedicine. How can they come together to see that they collaborate to provide adequate care and timely care for pregnant women so that we could reduce the ratio of maternal mortality and neonatal death in Nigeria? Because at the end of the day, I feel like if both come together to work, to collaborate, then we would have a very good space for pregnant women to actually be cared for and they will get all they actually need to get.
Yeah. So like in my point where I was talking
All
about
right,
like the
just a
government
minute,
providing
Esther. Let me
funding and
just
having to
hold you on there. We have a call. Hello, good afternoon. Hello, good afternoon. All right, we lost that call. Yeah, go ahead, Esther.
So I was going to say that, like I was saying in my earlier speech, that for the government, there needs to be more level of intentionality in properly equipping our health sector, saying that lots of women are losing their lives from lack of proper medical care and proper attention being given to them. The government needs to do a whole lot more. Look at the Federal Ministry of Health, health ministries in the different states, local, the health centers that are closest to people as well. We need proper funding. We need proper equipment to be bought into these different places because there are women who do not go to hospitals because they cannot afford it. In as much as we keep talking about women visiting the hospitals for antenatal, a lot of women cannot afford it because of the bills that they get saddled with when they get there, and they don't even know where to go to from there. So we need to be more intentional in doing this as a government.
All right, so let's pick this one. Hello, good afternoon. Can you hear me? Are you still there? Hello, good afternoon.
Hello, can you hear me? Hello.
All right. For trying because I know that
Hello, can you
the
hear
lines
me?
have been up and doing, and I'm sure that we'll definitely get to hear you. So, I think at this point we'll just take your final words. But hello, good afternoon.
Hello,
All
good
right, on
afternoon.
this report that you have given us, this very good work that you have given. Oh, okay. Hello, good afternoon.
Hello, good afternoon. Good
Yes, good
afternoon.
afternoon. What channel were you calling from?
It's Mari from Ayoko.
All right, Ismail from Maripo. Let's hear you, Ismail. Go ahead, please.
Yes, it's about my wife actually. Are you hearing me?
Okay.
Yes, she doesn't believe in all this
Yes, I can hear
antenatal.
you, Ismail.
Yeah, she doesn't believe in all this antenatal and hospital stuff. Like she does not have that belief in it. So I don't know what I can actually do. Like, can you give me solutions to tell her or something I can try use to convince her to believe in it?
Hmm. Okay. So she doesn't want to go to the hospital for antenatal at all. All right. Thank you very much, Ismail, for calling from Maripo. So Esther, this is this is one case, maybe out of so many. This is a woman who doesn't believe in antenatal. How do you think that, maybe Preggify could come, in the midst of all of this? Because that's another option. If she doesn't want to go to the hospital or she doesn't believe in going for antenatal, I think, telemedicine can actually come to her, like Preggify. Or what do you think about this one?
Yeah, I would. I mean, if we had more time, I would have loved to know why his wife doesn't like the idea of antenatal, because here she's the one in focus. She's the one
Mm.
who is carrying all of the pregnancy. She's the one who's experiencing all of the change in her body and needs the care of a medical practitioner at every point in time. And again, it might come from some sort of cultural background, depending on what level of exposure that she has or where she's grown up. Probably she has maybe like alternate medicine that she gets to use, and she's more confident in them than medical processes. However, what I would advise for him to do is he needs to find a way to get maybe a doctor friend, a medical practitioner who is going to sit his wife down, speak to her, and let her understand the intricacies of the necessity of her to speaking to a medical practitioner. And also another thing that she can do is, again, talking about telemedicine, is look out for like on women radio here, the radio doctor program, 10 a.m. to 11 a.m. Mondays to Fridays. She can get to speak to a doctor from the comfort of her home there. Look at initiatives like what Preggify is doing as well. So if it's going to the hospital in person that is the challenge, that one has been bridged. Then if it's the case of maybe taking the medication or solutions that have been offered to her, then over time she'll get on with it.
And what you want to see better, because I'm sure that there was a need and you went ahead to look at this need and look for solutions for this need. So what's your final words for this report and for all of us that's listening?
So I think I've said everything that I needed to say. See a medical practitioner as soon as you feel unwell or as soon as you feel like everything is not all right. Go to your medical practitioner, especially for pregnant women. Kudos to Preggify for the work that they are doing, and we're hoping that more solutions like this will come up and we'll be able to cascade it to the people at the rural level so they're able to adopt such, and that we're going to see more intentionality in our medical sector. Thank you.
Thank you too. Thank you too, Esther, for this robust report. And thank you for coming on to talk to us about this particular report. Thank you so much.
Thank you.
All right. Have a great weekend.
You do likewise.
All right. So that's it on the reports of pregnant women in urban Nigeria, a skipping hospital antenatal. With this, we have seen the efforts of telemedicine, such as Preggify, in bridging the gap in providing adequate and timely care to pregnant women. But this does not come without its own share of challenges. The Nigerian government still has a lot to do in making sure that there's a complete overhaul of the health sector and to also collaborate with telemedicine to bring down the rates of maternal mortality and neonatal death in the country. Thanks to our guest today, Esther Alaribe, for an excellent report and well into Preggify for providing a solution. Now, you can go ahead and read the full report if you haven't seen it on www.wfm917.com with the headline